Jessica DeMassa from the HISA Studio here at HIC 2017. I'm here with George. George, can you please introduce yourself for everybody watching?
Yeah, hi, my name is George Margelis. I'm a semi-retired physician who's been working in health technology probably for the last 25 years full-time.
Fantastic. So we're going to pick your brain about technology and healthcare in Australia. So tell us what you're seeing now that has you very excited.
So this is my 16th HIC in a row. So having seen HIC grow over the years and the change from it being a purely technology-based conference to a clinically led experience conference has probably been the biggest change from the HIC perspective. From the actual development of e-health in Australia, we've seen it become the norm rather than the exception. So when I first started, there were 100 pilots, each with 10 patients, each doing some really interesting stuff, which then produced the paper, and that was the end of the day. Now we're starting to see implementations that are actually making a real difference, and patients getting involved, clinicians getting involved, but even governments getting involved. Things like digital health agencies demonstrating that they recognise that this is a core part of how we deliver healthcare now.
It's fantastic. Are you seeing any challenges that are kind of new? I mean, there's a lot of attention on this right now. Are there any barriers that you feel need to be overcome still?
Look, one of the barriers which still remains is that clinicians need to understand this at a much deeper level. So we've seen clinicians sort of get involved. So clinicians like myself who literally had to leave full-time practice to get involved in informatics. And now we're seeing a flurry of new clinicians. So classic example, my son's a sixth year medical student. So as they're starting to get involved in this, they want to play a part in it, but they don't know how to integrate it into their daily life as a clinician. So we need more work in helping clinicians understand how they can do this and do their clinical job as well. It's not an either or. So back in my day, it was an either or. You had to leave clinical world to get involved in the technology world. In the future, that need to be so tightly integrated that you can't deliver clinical care without technology, and you can't deliver health technology without understanding clinical care.
How do we make that possible for the clinician then? I know there's a lot of talk, especially lately, about the physician innovator, and how do you create that persona? What's your advice there?
Look, I think part of it is freeing up some time for them to be innovative. I mean, again, when I was working in hospitals, if I got involved in an IT project, it was on top of my 80-hour week, which is just not feasible. So you need to almost provide them with time off to do projects that are relevant to what they're doing, but also develop leadership skills. Let them know that if they're disrupting the way they're delivering healthcare, that's not necessarily a bad thing. They're not the troublemaker, they're the innovator, and empower them as the innovator to drive through those barriers. I mean, junior clinicians are often scared of driving through barriers because it's seen as career limiting, or it's seen as being seen as a troublemaker by your superiors. Superiors basically need to be able to step aside and say, innovation is going to come from below. We need to enable them by just getting out of their way.
That's fantastic. As far as the e-health community, I guess, in Australia, as it's evolving now, what has you most excited for the future? Are there any technologies that you're really excited about right now?
Look, the buzzwords around big data and analytics are really good, but it's understanding what they mean at a personal level. So this whole concept of personalised medicine, of taking the range of technologies and doing what clinicians have always done, taking the best of it and delivering it to an individual patient. Because at the end of the day, healthcare is delivered one person to one person. So understanding the technologies, but diluting them, or focusing them down on what technologies do I need today for Mrs. Smith, and tomorrow which ones do I need for Mr. Jones. Fine-tuning those technologies to deliver clinical outcomes is the key thing from that perspective.
I love it. Technology that humanizes healthcare.
Absolutely. At the end of the day, the doctor holding your hand and delivering the technology solution whilst holding your hand is still a key part of delivering healthcare.
Fantastic. Well, thank you so much, George, for sharing the clinician standpoint here on digital technology and how it's evolving in Australia. Thanks so much.
Thank you.
This is Jessica DeMassa from the HISA Studio here at HIC 2017.